Hello everyone. Today we are here with Dr. Sabahat S. Azim, Chief Executive Zoe Technologies LLC. Hi Doctor, how are you?
I am good. Thank you.
So coming to my first question, could you tell us a little bit about yourself and your company?
So I am a medical doctor by training, but a technologist for the past 15 years. Right. Zoya Technologies is an integrated technology company. So it's not just software, it's embedded systems in hardware. And what we have behind us is a medical application of that. It's called ZoyeMed. And what we do is that we actually create a complete integrated uh, digital system inclusive of everything, software and hardware to run an entire automated business powered by AI.
Can you elaborate more on your products and solutions you are offering?
So this, what we see behind us is actually a complete digital clinic. This digital clinic is AI driven. It is an automation in healthcare. You can have a patient coming here. This machine senses the patient. It identifies the patient, pulls out his electronic medical records, finds out what is the problem that the patient has. You can do complete physical anthropometry of the patient, height, weight, blood pressure, temperature. It'll talk to the patient. It will understand what are the problems he's having. And all the tests that you need for the patient are done here itself. There's a hematology, there is biochemistry, there is immunofluorescence. So all the tests that in an outpatient visit our patient needs, they're done within 30 minutes in this machine. The AI does a differential diagnosis, tentative, and then connects to a doctor. The doctor can again examine the patient, finalize a prescription, and create a. So it's a complete one single stop clinic. You don't need anything else beyond this.
What technologies underpin the Zoyel.Health platform and how do they facilitate seamless virtual consultation?
It's a quite a deep. So we call it a vertical SaaS, which is a software as a solution
Right.
platform, which is integrated with hardware. So behind it, there are layers of technologies. So it's not like one single. So on one end, you have a cloud architecture where the whole stack is based on multiple source technologies. Like there is for your teleconsultation, there is WebRTC, the codes are in Python, there is our own AI, and then on top of it, there are third-party LLMs like Google's. They combine together, and the front end you have point-of-care technologies like dry biochemistry, hematology, immunology, and then automation of all these machines together. So it's a stack of multiple technologies that work seamlessly as a whole, with a backend in Python and the front end in Java.
So, how does Zoel Health integrate with existing healthcare system to provide a cohesive patient experience?
One is it is standalone in itself. And you can run an entire enterprise on this stack alone, which means that it will not only do your healthcare, but it will also do your management, your finance, your HR, your accounts, your meetings, and everything. Plus, it works with any standard industry system through APIs. So integrates at API level where it can call in with your existing system. If you have a hospital information system, if you have a LIS system, if you have an EMR system, it will integrate with an API, bring and give data to it.
Can you elaborate on how Zoel Health ensures the security and privacy of patient data during remote consultation?
First of all, this is HIPAA compliant.
Right.
It's certified HIPAA compliant, and the entire data is encrypted. And it runs on a VPN, so nobody can hack it. So on the cloud, there are multiple levels of technology. We typically host a standard third-party hyperscaler like AWS or Google Cloud or Oracle Cloud. For the client, the organization, or the hospital, it is sandboxed, which means we can't enter into that data. Nobody else can enter into the data. When the data is transmitted from here, it gets encrypted. And that data is encrypted, and there are cryptographic keys which move between, and there is the pipe itself of communication has a VPN on it. So it's completely secure. We call it in industry, we call it secure by design. So from the development stage to testing to final deployment, all is in a safe and secured environment.
So, like, have you faced any challenges related to cybersecurity? Because it's all about data.
So one part is nobody on earth can say that you are 100% secure from cybersecurity. That's not possible. What we do is we do everything that is known, but hackers come out with newer things, and then it's always going to be a cat and mouse kind of a game where people. But there are what we have built is a 3-tier level of security. So one security is at the machine level, at the edge level, where you encrypt and transmit the data without personal identification. Second, there is a sandboxing at the top level, at the cloud level, where you can't enter inside, and we do regular what we call VAPT, which is vulnerability assessment and penetration testing. There are tools for endpoint security management, which check if there is any intrusion which is happening. And you have, of course, the standard system like 128-bit SSL security, of course, are there.
Can you discuss any AI-driven features within the platform that enhance diagnostic accuracy of patient outcomes?
It's a huge amount of AI. Difficult to give it very brief. So let's say the AI here is actually, first of all, finding patterns of the patient's history, his examination, all the equipment that you see here. All of these actually are analyzed by the AI, and then an assessment is made. And that AI is not like a generic AI. It's guardrailed. There is a 15 years of clinical research behind it, producing those guardrails to let the AI move only in directed directions. I'll just give you one small example, which is not so obvious. So there is a stethoscope. The stethoscope converts that heart sound into digital signals, creates waveforms, spectroscope, which is analyzed and matched with disease patterns. But that is something which technology can understand. But what our AI does more is it actually tells the nurse where to place it. Because if you placed it correctly, the screen will turn green. It's actually battle tested. It's not a technology demonstration. It's not a POC. It's battle tested. And our digital systems have seen millions of patients. It works. It is fairly accurate. Every year, we add more and more AI features into it. But it helps you to diagnose correctly. It helps you to manage correctly. The AI prevents errors of drug interactions, contraindications, special precautions, all of that is built in, and there are strong guardrails around it to ensure that you are getting fairly accurate piece, which helps the doctor.
How do you personalize the treatment plans for patient during virtual consultation?
The beauty of a data-driven system is that the patient himself, with this encryption, there is a code assigned to a patient, which think of it like a zero knowledge proof kind of a system, where you identify in an encrypted way. When the patient comes here, the system is able to go back to his EMR, know what was the existing system. So everything from his diagnosis to the management plan to the dosages to the warnings are all, we call it precision medicine.
Right.
So it actually precisely gives what is needed for that particular patient.
Can you share any patient success stories that highlight the impact of Zoyel Health service?
Because of HIPAA, we cannot put in medical industry. It's a very regulated industry. We cannot share from the patient side. But I can give you an example without quoting names. For example, a 78-year-old patient, was diagnosed with knee problem and unnecessary surgery or knee replacement done. Subsequent to that, was diagnosed with Parkinson's and done. The patient was actually a case of NPH, which is normal pressure hydrocephalus. With the AI correctly put it as the first high priority that this is the power diagnosis, which turned out to be. So it's a classic case where good specialists, competent doctors failed to read in the first go and the second go, and the patient underwent unnecessary surgeries and treatment when finally the diagnosis was something else. That is the benefit of AI bringing in, because the scope of being able to check is larger. So it can see what the doctor or particular specialist may not have been used to.
So, like, what kind of market footprint you have, like both globally and in the Middle East?
Globally, we have about 768 clinics of various models. This one which you're seeing is the latest model out there. We have seen digitally with our organization in India and Dubai together about 11.5 million. We are in Mexico. We are in India currently. We are expanding to another, I don't want to name 2 or 3 other countries, which we are in the process of closing.
Are there any upcoming, products or solutions you are coming up with in near future?
So one is we are hoping to integrate ultrasound in this machine, which should be shortly done. And there is another solution we'll be bringing to the market, which is an automated pharmacy. A pharmacy that will take the prescriptions of the medicine, pop out the medicines and bag them all together and deliver it at the end point. So automated pharmacy and ultrasound is the next.
So, how do you see the future of telemedicine evolving, and what role will Zoyel Health play in the evolution?
We don't like the word telemedicine because it has been so abused that people with just a video link are calling it telemedicine. It has nothing to do with medicine. So we avoid the word telemedicine because it brings us down to the level of so many people who don't understand either medicine or technology who are using it. This is not a video between a doctor and patient. Digital healthcare is entirely different. Digital healthcare is a different paradigm. It is, think about it, a horse-driven carriage and a combustion engine to an EV is the same paradigm change that is happening. Digital health is not about digitizing records. It's not about using a video. It's actually being able to get more data, being able to analyze that data more accurately and predict diseases before they happen or manage it in a better way with a precision which was unparalleled because we did not have the ability to crunch this kind of data and find those kind of patterns before. I can say with fair amount of certainty, the world of medicine is going to change completely differently. It is a last industry which has not yet really, so the technology in medicine has generally been in the pharmaceutical or medical devices. But healthcare delivery is transforming, and COVID actually gave an impetus to it because you are locked up. But the world is changing, and I can guarantee you that in 5 years' time, not 10, not 15, healthcare delivery will be completely transformed. We want to be at the forefront of it, at the cutting edge of it, at the vanguard, not laggards behind. And those that will not adapt, not change, are missing out. What are the possibilities? We can bring healthcare to everybody wherever he might be in a remote island, maybe in a moving vehicle. That is possible today. Everybody in the world is working towards it. We want to be partners in that growth at the cutting edge.
Right. I think that is all. Thank you so much for speaking.
Thank you so much.
Thank you.
Thanks, Satan. Pleasure meeting.